Thank you, dear Dominic, not only for the presentation and your constant kindness, but also for inviting me and for creating the opportunity to be here in this experience at Wealth with my friends with whom I study in the undergraduate program. We always saw University of Wealth as La Mecca, as the place where the most brilliant veterinarians go and study and learn. So for me, it's a big gift in my career and as a mother of beautiful child to be here, because it's a gift for me. So, and being your friend and your colleague and sharing all the OLEP experience has been a true treasure. So saying that, I thank you everyone for being here, also online. Thank you. There are many known names that I saw in the list for the people online. So I'm happy to present you today one of the experiences that we have been doing in the last 5 or 4 years, but especially 2 years ago, the Pan American Health Organization wanted to have a mapping of the One Health initiatives in Latin America. So they were interested on understanding how those initiatives were settled and how well they are doing on One Health, and that's what I'm going to present you today. So there is a context, a global context that obviously at the One Health Institute, and I also want to thank Catherine and Kate, Dr. Kate, for everything that you have done to create this institute that is a leading institution for all the Americas. We are learning from you with all that what you are doing, and in that context, the education is very important. No? In the context of the priorities to the One Health implementation. Thank you also for all the opportunities to grow online, because I didn't know just today that is online. So I will share widely the One Health Institute activities. So, well, coming again to the priorities, I want to highlight that in 2022, the 4 leaders of the quadripartite institutions came together to do a statement on 7 priorities. But I want to point out the 3rd priority, that is accelerate the implementation of One Health plans, updating the One Health governance and multi-sectoral coordination mechanism, and develop situational analysis, stakeholder mapping, priority settings, and metrics. This seems very, very simple, but for a country like mine and many of the countries in Latin America, this whole point is very, very demanding and very. It takes a lot of time to understand what has been done, what are the situational analysis, and all the metrics to learn and monitoring and evaluating the One Health frameworks. This was released in 2002. In 2022. In 2023, the guide to implement the One Health Joint Plan of Action was released, and maybe some of you know this guide. This guide is very user-friendly, in my view. It has 5 steps, and the first one is situational analysis, which is very correlated with what I'm going to present you today, because it's also the mapping of the situation. As you can see, many countries have started following the guide with the One Health implementation, but the first part that is a stakeholder mapping, review national One Health governance and coordination mechanism, it was not really clear for many countries to understand which are those multi-sectoral mechanisms to start working with. So that's why I want to focus on this story of the Pan American Health Organization and PANAFTOSA, which were the organizations who made this exercise in 2020, 22. Actually, we did this exercise in 2022. But I want to acknowledge that the PAHO is an organization created in 19, how you say it? 1951, the Panaftosa. But PAHO is from 100, and how can I pronounce this? 1902. 1902. So it's way before the UN organizations were settled. So that's why the whole view and the organization and the way they work was already multi-sectoral because of many of the campaigns, the health campaigns they start 120 years ago. They have already this view. And the Panaftosa, which is placed in Brazil, they have focused on the veterinary public health activities in the region. So their main areas of interest are foot and mouth disease, vesicular diseases, production of diagnostic kits, food safety, zoonoses obviously, and accidents caused by poisonous animals. So given this context, I am going to introduce you to the One Health policy of the Pan American Health Organization, which was started 1 year before the quadripartite create this, the first slide that I show you. When they do this call for action, the Pan American Health Organization was already set in place a regional policy, a regional One Health policy. You can access this document in the link that is down in the slide. But what is important is that they create the whole legal framework for the countries in my region to do this, to foster coordination, collaboration, and the different governance frameworks around human health, animal health, and environmental programs. So this policy has 6 action lines, 6 lines of action, and the first one, as you can see, is mapping the context. That's why they wanted to create a document and to create the baseline to understand what has been done, what are the good practices in the region, what has worked actually. To then do the strategic line of action 2, which is establishing more clearly those multidisciplinary and intersectoral mechanisms, because they knew that all countries has in some level a development on the multisectoral organization. Maybe not calling it One Health, but they already have in some way this organization, this dialogue and these coordinated programs. The other lines of action are in process, but obviously this is in line with the joint plan of action. But I wanted to acknowledge that they are different. It was done in a different time, and without the guideline of the UN, let's say, these documents, the high-level documents. So for me, that was very impressive because they were like pioneering this work in our region. So the objective of this work, it was to identify best practices for operationalization of One Health in Latin America in order to manage public health risks at the human-animal environment interface and with accordance of this previous One Health policy that I show you. So the methods that we used was we did a meeting in Rio de Janeiro, bringing together the ministries of health and agriculture of 10 different countries of the region who they know they were doing good advances and they have good experiences to share, good practices. Another part was a literature review, understanding and checking all that has been published in the last 20 years in the region, specifically regarding the One Health advancements. No? So this is part of the the results. We did the meeting. As you can see, it was in the middle of pandemic, so it was an interesting workshop where these countries that you can see present an initiative based in their own country of good practices. I'm going to show you now. And also the 3 OLEP members, the South American OLEP members, which are Dr. Janice from Brazil, Janice Ciachi, and Dr. Natalia Casas from Argentina, and myself, because it was like the opportunity to meet with the people who are doing really One Health in the countries, that there were the directives and representatives of the Ministry of Health and Agriculture. They have from the first hand the pros and cons of doing this work, and the disappointings they face normally to do this. So it was a very good experience for us. As part of the results, we noticed during the conversations and dialogue that we had, it was 2 days of work, that you can see that the most important topic that came into the table was establishing governance and legal frameworks, because it seems that we have progress, that we can say that we can, for example, one of the big results that we can show to the world is the reduction of the cases of rabies, human rabies, given the important work, intersectoral work that the PAHO has led in the region. But that has been done, that epidemiological result can be shown not because we have legal frameworks, saying One Health. This is because the whole organization, whole government and whole society approach was applied during the last 30 years. For example, bringing schools, bringing universities, bringing the private sector, because they create the vaccines, creating also awareness on the human health side, that nowadays a case fatal or a death from rabies is not negotiable. We cannot allow that. And you can see that in 1080 SAR, we have 80 cases of human rabies, and nowadays we have less than 5 or less than 3 in the whole region. So it was clearly a whole effort, but no one told about this with One Health. It was called differently, or it was a different awareness and different, the guiding was to reduce the burden of disease, not only One Health, no? The second most important topic was the importance of the environmental sector, which was very clear in the importance of bringing together the quadripartite, because previously we had the tripartite, and the way that the global at global level, given this sign that the UNEP, the United Nations Environmental Program, coming together with the quadripartite, gave example to all the regions that we need to integrate the environment. So that was mentioned many times, the importance of, because Latin America is one of the most biodiverse regions of the world, and it was not very acknowledged, the role of the environmental sector in health, in the health field. So that was mentioned many times. And also the importance of identifying the stakeholder roles, and the importance of international organizations, because they have promote the funding, and also they have the leadership. For example, FAO and PAHO and OHI, they have leadership already in the region. So they were mentioning the importance of creating in some way the quadripartite quadripartite in the region. We don't have that much in the region because we can see, because of the history that I told you, the difference on time that those organizations were created, but also, for example, WOHA has one office in Argentina, but the numbers of people who work in these offices is not enough for the whole complexity of the region, and also UNEP. So that's why we wanted to understand if we can have the same quadripartite in our region, and we are learning about it. So I'm going to continue. The other interesting result was that it was mentioning the first strategic line of action that, if you remember, is mapping. It was named the second, no? With 30% of the opportunities, no? They were explaining the importance of mapping and understanding the specific national context, because we cannot formulate a formula, no, to apply to every country. We need to understand how does each country work and who are the stakeholders, and what can be working in one place maybe is not working in another country. So that's why it was important to meet together and to learn from each other. The second most important was, was to establish multidisciplinary and multi-sectoral One Health governance, because they were saying that it's not easy to implement One Health without a true governance in each country. And this governance was, how can I say, this governance can be rooted in the zoonosis control programs. Each country has already a story of controlling zoonosis, and so obviously of MAR, the antimicrobial resistant efforts, they have already something on that. And on food safety, no? Food safety is also a key aspect of the programs in Latin America. So they mentioned that we had to start from that, no? From what is already existing in place, and not creating something new suddenly with a different governance, because it can create delays and maybe not clearly not identifying clearly the roles of every sector. So I'm going to show you now the best practices of the countries. Obviously, it's hard to put everything that one country shared, but I wanted to highlight like the best practice of each country. So Argentina brought to the table the importance of their work in the SARS-CoV-2 pandemic. They brought together the coordination of the zoonosis at the National Ministry of Health, and they create 3 different guidelines to detect the SARS-CoV-2 in animals, in zoos, in rescue centers, and in wildlife. So this was very interesting to see, because as I told you, Latin America has a great biodiversity, and in pandemics, it was very known that also wildlife was infected, and it can create a huge impact on this part, on the biodiversity profiles of each country. But what she mentioned, Dr. Natalia, who presented this, she mentioned that there was already intersectoral network, but with the pandemics, it got strengthened. They commit to meet often. They try to create these guides, no? So this is a clear example that maybe when we have these outbreaks, the intention of collaboration is deeper. From the side of Belize, they create the National One Health Committee platform. That it was a surprise, because it's in the Caribbean, and you can see the resilience of these islands, of these countries, sorry. And what it was very interesting to see from Belize, it was that they understood that in each of the ministry, there was institutions that have developed committees or zoonosis councils. So they say, we don't need to start from zero, we don't need to create the wheel, we need to just activate those zoonosis councils or committees and strengthen, activate them with the One Health vision, So another important thing that this Dr. Joey told in this practice, in his country's best practice, was that they have promoted transparency and trust building among people, because they say that you cannot do this work without trusting the other partner or the other organization. And for me, that was interesting that came in the table as a best practices, because it seems like the soft skills are not important, but for our region are very important, to create trust among people, to be transparent, to have accountability is some in all activities, but also in the communication. They say that it was important for them to create this platform. From the side of Bolivia, they were saying that they were planning to create this zoonosis prevention guide for the country with the One Health approach, but they were in the process of reflection, of internal meetings, of creating this new way of working, But it was not new. They were saying, we have been meeting together, and we have the risk assessment, the risk management and communication, and the training based on the multi-sectoral work. But what they didn't have was the governance, like a law, like the obligation to work together. But they were doing these steps towards that. On the other side, we have Brazil, which has a strong political support and leadership for the One Health activities. They have published many papers on their advantages of working with this approach. Actually, the Brazilian health system is based on multi-sectoral work, because they have the SUS, which is the Sistema Único de Saúde, and this SUS is clearly based on primary health care, and this primary health care is multidisciplinary by nature. So that's why, for me, Brazil is a leading country for many of the countries in Latin America. They actually, before pandemic, they were starting a One Health technical group, because people in the government are really advocates and champions on One Health. And with the pandemic, this work has been reinforced. So what we know, and what is something that we call best practices, what Brazil has done this year, establishing interinstitutional technical committee for One Health. This was done by law. They create a decree to create as a mandatory work. This work can be done not because it's nice or because we think that it's good. No, it's because it's by law. And that's why the other countries of the region, we are trying to understand how to do this law, how to create a decree, or how to take this example of Brazil also for us. So now with this example, for example, Colombia is also planning to do a One Health policy, but it needs to be with a lot of dialogue, with a lot of understanding of how the previous laws has been doing good things or has been weak. We need to do a policy analysis, and this is not easy to do or integrate someone to do it. So another example from Brazil was the epidemiological surveillance set in place in this country. There are a lot of publications regarding how they are implementing this intersectoral surveillance, not only for yellow fever, but also for many of the MAR situations or for zoonoses. Brazil has a very solid and robust epidemiological surveillance system. And this is an example, no? This reference, the Wakimoto, was one of the examples that Brazil is also showing what they are doing. And that gives us also the idea of that we need to reinforce and to strengthen the policy science interface in the countries. On the other side, we have Chile, which they start very early in the century with the food safety policy and the food quality policy. They have an agency called ACHIPIA, and this ACHIPIA works, and the base of this platform is based on multi-sectoral communication and coordination. Why? Because the food safety approach, the chain approach, implies to coordinate, to collaborate, to communicate, and to build capacities around not only the agricultural ministry, but also the health ministry and the economic ministry, but education ministry. They have very strong practices around this policy, the food safety policy, that for us was very impressive, because in Latin America, many countries start at the same time with the food safety changes, no? Opening the markets, our internal markets to the international markets at this point. But the example of Chile was very, was a good, has a very good governance regarding these good practices. No, they were showing many. Because their economy is based on the salmon industry, and they know that if they didn't do this well, the whole economy will fall down. No, so that's why we could see that the risk, they base their policy on the risk assessment for the food industry. They know that if they fail in some part of the risk assessment, the whole the whole food security and food sovereignty can be in danger. No? So it was very interesting to see. Now with the example of Colombia, we can, I wish we can have more examples, but what we are doing is creating, taking advantage of the initiatives that, for example, CDC has led in the region, the One Health zoonosis prioritization. So Colombia was the first country to create this exercise of One Health prioritization before pandemics. So it was very interesting to see that this exercise put together to talk around the One Health before anyone was talking about it. No? During the last days or the last years, we have seen advancements regarding the application to the pandemic fund that has implied a good, the government has the intention to win, so obviously they want to present all the work of multi-sectoral coordination. But the truth is that we need more. We have a lot to do in terms of cultural shift to work with other sectors. And this year also we have the COP16 on biodiversity, and it was a very interesting way that the government convinced themselves to invest on One Health, because they saw how much importance is given in the world to these topics. Remember that the environmental sector was not clearly integrated into the One Health, but with the COP16 it was a true reality. We saw how members of the government were defending and arguing how the environment is important for pandemic prevention, for food security, very empowered in the discussions. So we saw, for me, the COP16 was in One Health terms, a before and after, no? So it was October this year, so it's very recently. So, and also, something that is very interesting is that this year, also, FAO brought a project called ECTAD, which is Emergency Center of Transboundary Animal Diseases. And this project has brought a lot of awareness on the people from the government, and it seems like in my country we can cooperate more when there's another institution who invite to the meeting and who create the opportunities to talk. No? And now we know that our country is going to participate in the Nature for Health application grants, which are the UNEP call for creating the One Health, no, the national action plans for health and biodiversity. So we have a good opportunity to start to reinforce and to strengthen our plans. Another good practices that in Colombia we have done is strengthening the science. Sorry, because science was not written well. It's lacking a S. So what we want to do is create the evidence, the scientific evidence, for people in the government to make better decisions. So we did this study with my master students. They were very interested in joining One Health. So I said, why don't we do this? For example, this survey, it was a survey that was previously done in Europe with many countries of Europe regarding the One Health perception, barriers, and opportunities for different countries. So all the authors are from the University of Turin, and Ana Maria was a master degree student. So that's a way to create more awareness, but also to create evidence for policy making. There's another student who was very interested on rabies, and what we did was a One Health assessment using a methodology created by CIRAD in France, and we applied it to the rabies program in Colombia. This was just published the last week with the rabies program. And we noticed, for example, that from these examples that we are doing well, but we need the governance part. We can say that this is important, but that's why we need the One Health governance structure really as a mandate. No? This is another study created to understand the bottlenecks and also the governance structures in the country. We understood from this study that we have already commissions, intersectoral commissions, created 12 years ago, but they were not activated as working daily or monthly. So what we are seeing is that we can activate those spaces, but we need the commitment from the ministries to give the advocacy and to give the support, because most of people who are part of these commissions are technical people, no? People who runs the program, rabies, yellow fever, all those, but they don't have the power, the high power to say, I want to give that X money to this program, or it's lacking the higher support. So now what we are doing is convince those higher levels of decision making. Another good example is the public-private partnerships that we understood that for the antimicrobial resistance program, there were a lot of examples from the public sector and in communion with the private sector. what is the private sector? The producers, no? The people working on the aquaculture, people working on the livestock sector, the avian producers, the pork producers, all of them has a lot of power in our country. And if we don't include them and we don't create agreements and mechanisms to consider them as a huge and important actor, we also are risking, no, that prevention can be seen as a threat because in some way, you know that for the antimicrobial resistance, the use of drugs or medicines as a growth promoters, they can see this a practice. This is a practice that is not possible for us. But when you do these public-private partnerships, they can convince that prevention is part of their good practices. No, that these activities can be also be more. They are followed in a different way. For example, we noticed that with these agreements, the monitoring and evaluation of projects are more rapid, are more than if we don't have the private sector. If they have a know-how, that is important for us. The Cuba example was around the integrated surveillance systems. You can find this example in CAVI One Health. Also, the previous one is published in CAVI One Health. And the Honduras example was about the importance of reflecting on the food control system. They were using, for example, participatory methods to change the whole vision of the system, and what they shared was very important because they say that first we need to be very self-critic on how the programs can be improved, and then to allow other methods to make decisions. For example, they were noticing that participatory approaches to reflect their own government, to reflect on their policies, it was a good practices for them. And in Mexico, they were very happy sharing about the teniasis and cysticercosis program because they include communities. So it was a very interesting example of engaging with communities without very rural places, no, that they understood that these programs to really work well needs to have an adjustment on the language and an acknowledgement on how they took decisions, no, and it was very interesting also to see. And from Uruguay, also in relationship with Mexico, they talk about the inclusion of stakeholders to impact the One Health approach in rural schools and indigenous communities. It was very interesting to see because that, as you know, maybe you know, that Latin America has the shame of being the most unequal region of the world. And that's why this inequality comes from not acknowledging indigenous peoples or Afro-descendants peoples, and all the rural communities of the region suffer from lack of clean water, lack of food, lack of energy. There are many things that are considered rights, but they are not already in place. Human rights, no? So that was mentioned by Uruguay and the importance of that. I'm going to go through this exercise I want to end with this exercise these good practices. The IICA, which is the Inter-American Institute for Cooperation of the Agriculture, they have been working for the last 5 years on strengthening the One Health transformation of agri-food systems in the Americas, the whole region, Canada to Argentina, and they have given evidence on the importance of One Health in rural communities. And with surprise, this report was published last month. They create a working group, continuous working group, focusing on the agri-food systems. But what is very interesting to see is that many countries and all these institutions are part of this working group. So even if IICA is not part of the quadripartite, we have other agencies who are taking leadership and who are promoting the approach, and that's very valid, and we see that they are creating a lot of governance. Actually, this governance that we were talking, they are creating the base to do that. This is a One Health directory that we create because of the systematic review that we did. This is in constant growing. I know that if we want to update this directory for all the groups that have been created in this year, this can be the 3 more times of the institutions that they have a One Health student club or One Health group or working group or networks. It's growing, and it's happily growing because people are understanding that importance. And to end, this is a call that I invite you to share with your LATAM colleagues, with Dr. Marco Vigilato from PAHO and Panaftosa. We want to know, and we were invited by this journal to create a special topic on this public health and zoonotic neglected tropical diseases with the One Health approach in Latin America and the Caribbean. So we are waiting for your papers and for understanding how to do this, the next step. So to end, I just want to, I think that the lessons learned, I was telling them each time I was speaking from the country, but the things that I consider most important is that these changes, this transformation in health systems came from conversations, from reflections, personal reflections. Not all the time they came from big decisions of the government, the high level, but because people think that they can do better, that they can improve the way they do. So that was very important to highlight from the workshop. There's the importance of updating legislation or frameworks, the importance of participatory methodologies. For Cuba and Honduras, it was important. And also to use the institutions that have well-developed intersectoral communication. Maybe they are not called One Health right now, but we can adjust the name, or the important is that we activate those mechanisms with the frameworks that we have already. And what we see is a very important outcome from this study is that the academia and the institutes of higher education has been leading and pushing forward the concept. It's like maybe the governments are a little afraid of taking the leadership, but with the support of the academia, they are feeling like more trust. they feel that more confident to do this step, or at least this is my experience with Colombian government, that they say, okay, let's be guided on this this process, this map, because they don't know how to really is going to be seen the One Health, because this is a growing field and not all of them has an example already in place. I think Brazil is going to teach us a lot for the next years. So I want to thank all the countries that participate in this study, also the people from PAHO who review the process and who joined the workshop, for the literature review, Mabel Ortiz and Jaime Romero from IICA, who share all this process internally in this agency. So thank you very much.